Cancer has two trajectories, metabolic and mental spiritual. It makes an enormous difference. Except for several cancers, such as breast cancer, in which there is a gene mutation, the hereditary component of morbidity is not dominant in most types of cancer and does not exceed 10%. Why is the distinction between the causes of metabolic and mental spiritual cancer important? Patients with cancer in the metabolic pathway usually suffer from less violent cancer. Patients with cancer in the mental spiritual pathway usually suffer from more acute illness. The explanation below. Health is always a combination of body, mind, and spirit, but the mental spiritual issue has difficulty measuring and quantifying. Why do huge animals, such as whales or elephants, have no cancer? After all, their bodies contain a huge amount of cells. Peto's paradox. There are several theories on the subject, but the simplest and most convincing is that large animals have a much slower metabolism. A good measure of the metabolic rate of different species is the heart rate and respiration rate. The inverse relationship between resting heart rate and life expectancy in animals, in general, has been found in many biological studies. The question that needs to be examined is whether the inverse relationship between metabolism and life expectancy and cancer morbidity also exists in humans. Since all the laws of nature are uniform, there is no reason to assume that human beings are exceptional. Why does the age at which cancer first breaks out have vital clinical significance? Treatment must be tailored to the causes of the disease, otherwise, recovery chances are lower. If the mental spiritual factor has been identified, the treatment will be completely different from that in which the physical, metabolic factor was identified. Young people do have a faster metabolism than adults, but also a stronger immune system. Paradoxically, they suffer from more violent cancers than older people. Why? The impact of body, mind, and spirit on our health is not uniform throughout life. Ratios are constantly changing. At younger ages, there is a higher weight of mind and spirit. At older ages, the body metabolic weight increases. Cancer patients in the Middle Ages, 30 to 60, are the most difficult to treat because they combine physical and mental spiritual factors altogether. It is not surprising that cancer among young people, on a mental spiritual background, is more violent than that of the elderly on a physical metabolic background. Thank you for watching this video. I wish everyone good health.